So it's as if something is happening with this virus and the poison of the virus that is exposing this cultural poison, the poison of systemic racism and the economic injustice that's embedded in the systemic racism and the history of it. So that it's as if the phenomena of the virus and the stress that it's posing to us culturally and globally it can't help but bring to light some of these these historic issues that had been present prior to the virus, clearly, way prior. But somehow it's being brought to light, and there's something about that movement that bears attention.
Yeah, I think that's true. And I think that some of us, when you talk about shadow, you talk about putting the light onto it, and adding light to it, which increases consciousness. So I think that, and the news cycles are fast, and the stories go fast, and we're in an extremely speeded up moment where different things are happening as they were in a way for the last few years, really fast. But you mentioned earlier when we first started, you said, maybe we could slow something down here, and sort of like taking out the weaves, like doing an unbraiding of something to look at how things are moving along or trailing along. And I think that that we could do that, because I think that we're in this moment of time. To me, it's an interesting moment. It's like things are speeded up in a really fast way, right? And then they're also going really slow. So it's like, how do we use both of those patterns of something going fast? I think partly because our egos want it to be over. I know I feel that within myself, like I want it to be over. Like, where's the vaccine? Where's the help for people? Where's what we need? And then there is the slowness that the moment demands, because it is like a moment of, I think, deep sorrow and deep grief that we're all facing collectively. And this is globally. Like you mentioned the word global. This is global. This is not just Americans, so.
So I'm just going to take a little bit of a leap here, and because I know from a depth perspective that sometimes we do use the imagination to kind of imagine into what's happening and whether or not there's a logic of some kind. You mentioned homeopathy, that there's some kind of we could wonder whether there's some kind of a possible healing process in place, or at least the potential for a healing process in place. And this slowing down could be a part of it. I've heard the term reset used a number of times in the way that things are being talked about. Like, do we have this moment to reset? And including, do we have this moment? Are we being, in a sense, offered this opportunity to really take a look at factors like systemic racism that, and we've talked in the past about white shadow as well, and whiteness, and kind of the phenomena of a kind of blindness within a white cultural perspective to the realities of communities of color, including the reality that you've just mentioned, for example, that there might be a predominance of people of color who are essential workers, who are being, in a sense, compelled to work on the front lines and are being disproportionately subjected to the threat of the virus, and that from a kind of a conventionally white perspective, that might go unnoticed, as would the murders that you're talking about. And not only that, but the history of injustice within the healthcare system itself, which I know you've written about. So I just wonder if something is happening in which we are actually being given an opportunity to uh, to evolve, to really kind of develop a different understanding and attitude toward the inequities that are so present and are so agonizing and debilitating for us collectively, but that yet nevertheless persist, you know. So the question always is, what keeps it intact, and what, if anything, can we do differently?
Mm-hmm. Yeah, I think that's really a big question. You know, it's a societal question. You know, it's a question of how we deal with ourselves, not just on the ego level, but also on an unconscious level. Um, does it matter? Does it matter to someone that a nurse will stand in the Oval Office and say to the president of the country, we don't have the equipment that we need? And that this nurse could be criticized, right, in a negative way, because she has the audacity to go into the Oval Office and say, we don't have what we need to be working in hospitals, to be treating patients. You know, we don't have it. And so how do we gain enough consciousness to be willing to help and support each other and to be kind? I think that there is something about learning how to have compassion. And I think it takes time, and there's a slowness to learning how to have compassion, because you have to have compassion for another. Like you hear more frequently now, in wearing a mask, it's not really for you, it's for the other, right? Like that's the message that we've been given. I personally think it's also for those of us who choose to wear the mask, it's also for our health, because I think there's a mutuality there. It's for another as well as myself, right? So I think that that idea of compassion towards another, in even the wearing of the mask, which is the message that we keep getting, it's for the other so that they don't catch something, is also for us, the mask wearing. So I wish there was more conversations that talked about that mutuality and how we could meet each other with kindness and compassion. It's an exchange. It's myself and it's another. And I don't think, as Jung did, that skin color will stop making a difference anytime soon. We can see from this pandemic that it really does matter. It really does matter. Skin culture really matters. And I think that we have to start from the heart. We have to start from the heart and consider places of where compassion and kindness can originate and develop from. Because I think if we go to the ego only, I think we get afraid. We become afraid because we're afraid for our own mortality. And I'm not saying there isn't anything wrong with that, because it's just being human. But the question is, how do we bring in compassion for the other? How do we do that? Mm-hmm. How do we do that?
How do we do that?
How do we do
that? And so there's also the idea that somehow this moment is compelling us to ask that question maybe in a more energized way, or maybe in a new way, or in a way that has a sense of urgency that is a little bit different for most of us.
Yes, and I think even in the mask wearing, like I notice that people will say hello to me, like strangers, like, you know, we're wearing masks and they're greeting me and they're allowing me to be visible, because in wearing the mask, there's something about invisibility. There's something in a way that says you're not really there, because so much of the face is covered, right? And only the eyes, right? To the soul, perhaps. That's what's showing. And so it's interesting to have so many people like have this friendly greeting for me, even though I'm behind a mask and I'm thinking they cannot, quote unquote, see me, right? So there's like, I think, a reaching out, I think, and they're friendly voices, like they want to acknowledge and say hello and, good morning, good evening when I go for walks in the evening, people wanting to connect, right? And I think that that's something that we're dealing with, like in the language of social distancing, it's like for protecting ourselves, like we still want to touch one another. So how do we touch and embrace one another, right? We try to do it through our voices now, like a friendly hello, maybe more softness in the eyes. How do we do it? Heart energy. How do we do things energetically when we cannot touch? Someone standing outside of a nursing home, their parents are in the nursing home and they're standing outside with their hands against the glass. And, how can we touch one another? Maybe that's one of the things that we're also looking at, right? Like, how can we be really in touch when the language is social distancing? So it's really, I think, allowing us to think more about touching in a way that perhaps we haven't really entertained it before, because there are these two opposites. We talk about opposites in Jungian language, Jungian psychology, the opposites are at play, social distancing, while we're also talking about touching. How do we touch one another with social distancing? Mm-hmm. Think of that.
I've been thinking about that a lot, actually. And I've been thinking about it even through technology. How do we touch each other? So many people and students and clients are, reporting that it just doesn't quite feel the same. And there's just something that's missing. And then yet at the same time, like I feel really connected to you right now. There's something that feels very palpable about that. And I've just been really curious about it, like what is it that we're doing when we connect, and how much of that has to do with our proximity and so on. And so I don't know, those questions are just being raised, and somehow I'm coming back to this, this social challenge, which is how do we really dismantle racism, and how to use this opportunity to get into the DNA of that, or the RNA of that, so that we can really recode our social patterns, and because there's something that is so, it is kind of like a social virus. As I'm listening into our conversation, I feel like this is another kind of virus that we've been living with for a long time.
Mm-hmm.
And somehow we don't even have close to a vaccine for it yet.
Mm-hmm.
But is it possible that some of what you're saying, which is that this, a capacity, not in a kind of a superficial way, right? I think what you're saying is really revolutionary in a way, which is how do we become kind, really kind, and how do we really see the other and see into the soul of the other? And whatever that kind of light show is about what our old conditioning is telling us about the other and so on, how you've been calling that the ego in a way, how to kind of notice that as something that's not necessarily the highest priority in the moment. And it doesn't have the highest survival advantage in the moment even, right? These are kind of, I think, profound challenges to consider. And I guess I'm on the one hand very optimistic about that, but on the other hand, I'm so I'm agonized along with you also around just why is it that some of these why does this social virus persist to such a degree when it's so devastating, and so obviously devastating to hear about another murder, to hear about the the disparate impact of mortality, you know, just again to be just kind of confronted with the data is just makes the question that much more kind of troublesome. Like, what is it that has that blindness persist? And is there any sort of small iota thing that each of us can do that would really help to move the needle on that? And,
Yes, and you know, I know that sometimes because I get asked this question, you know, like how do we heal our racial complex, right? It's like how do we heal it? And I say, well, the bad news is that we don't heal complexes, that we learn how to live with them, you know, and we learn about them. We learn the language of a particular complex. We give it language so that we can understand it better. We join with one another on the same page. So we have the language, we have an understanding of what the language means. Like there's that mutuality there. Like if I'm saying red and you're saying purple, like, well, that could be sort of close, those colors, you know, in the mixture, but maybe like, okay, let's say white and black, right? So when we say those two words, like they could be radically different, but we want to have some colors that are joining together, like lavender and purple or pink, you know, in the same family, talking about it linguistically, right? Like creating a mutuality in as many ways as we can. Like, is this a part of our healing of the complex? Like, first we have to say, oh, there's a complex here. And in depth psychology, we have talked about complexes ever since Jung was talking about complexes, right? And he even mentioned a color complex. So this is not alien to us. We just haven't revisited it in a long time. So now we revisit it as depth psychologists, and we say, okay, here's this complex that's, oh, it's not going to get healed. No, complexes don't get healed. They get worked. We shine the light on them. We bring them out of the shadow. We learn how to tolerate them. We learn how to be embarrassed by them because they cause us to be embarrassed. We learn how to hate them. We hate them once we see them. You know, we hate them in others. It's the projection. We learn how to pull it back. There's all this work to be done in that psychological way around our complexes. And then we have to say, okay, there are these complexes. If I can own it, right? Doesn't that soften me after I get over being angry that I have it? Because at first we're angry that we have it. That's not me, that's them. And then once you can truly own it and you can feel the sadness and sometimes despair around owning your own complex, then we have something, I think, the beginning to work with. In the case of Aubrey, the young man that died, the mother came on the news the other day and was saying how someone had left a note for her, expressing empathy for what had happened, condolences, right? And so the mother, Aubrey's mother, went on and said, I want you to come forward because maybe you've seen something or you understand something about what's happened. And, you know, people would like, law enforcement would like to talk to you as a witness. And I guess the person has come forward, but what they said was, I was just feeling the sadness and just feeling the sorrow around what had happened to you and to your son. And so that's more of what we need. That's compassion and feeling the heart, you know, feeling heart energy for healing. Because to me, that's a part of the remedy. Like that's the remedy. And it's a part of loving, I think.
It's really beautiful. And I think for a lot of us, maybe that's also conceivable, that we could soften for a moment with ourselves, first of all, and our own hatred of our own limitations, right, as that comes up. And also to soften to the possibility that we're more alike than unalike, and that we can really, really feel each other's pain. That when you hurt, I hurt. When I hurt, you may hurt too, and that we're connected, and that somehow that illusion that we're not connected is hurting us, and that we can somehow wake up to that a little bit more.
Yeah, I think so, because around the world, we're all hurting. Around the world, it's like a circle of sorrow, really.
Yeah.
It really is. Like we're all hurting.
I know.
Yeah. And I like, us talking and thinking about a remedy. Like you called it a social virus. I agree with you. It's not just a biological virus. It's affecting our immune system and our lungs and affecting our children. Children have started dying from this, where there was a way, like false language that said children could not catch this virus. We don't know so much. There's so much we don't know about this virus. And a part of Jungian psychology is, I think of it as the psychology of discovery. And so this virus is behaving in the same way. There's still so much we don't know that we still have to discover. And I think that we need a circle of care that really can motivate us. Like we don't need to segregate. Like this is a circle that needs to hold. We need to hold a circle to take care of one another. We need one another. We really do. I don't know how we can do it without one another. We need every trash collector, every garbage collector who's picking up our used gloves, that we're afraid might have the virus on. We need every sanitation guy. I really appreciate them, much more than I ever have. We need every nurse. We need every doctor. We need everyone to be in that circle of care. So that's how I'm thinking of us in terms of remedy.
It's a beautiful vision, the circle of care.
Yeah.
That's great.
Yeah.
I'm aware that we're at the end of the time for this podcast, and does this feel complete for now for this conversation? Is there anything else?
No, I think we're fine. I feel like we started off, in a faster rate, like a faster pace, because we're feeling like, okay, we're coming together, and all of that energy, right?
Yeah.
Is so excited to be together, to be with one another, and to share with one another again. So there's this natural excitement there, and I think we've found a rhythm, to be with one another and to give each other something to think about, and hopefully to extend our conversation through the podcast for others who we're all in this conversation, whether it's within ourselves, that interior conversation, whether it's with family that we are sheltering with, whether it's someone in the grocery store, in the supermarket, on a broader base, it's global, and we're all in this conversation. And so I hope that, we've been able to slow it down enough and have enough language to have the colors be together enough on the same page, right? So that they're attractive enough and available enough to broaden this and deepen this conversation that we've had today.
Yeah, and that it's an invitation to join the circle of care in whatever way that's possible.